to take the leadership. Steward means taking supervisorship or taking the leadership as far as this program is concerned, so that somebody should be made an accountable person. Somebody should be made who can actually educate the person. Somebody should be made who can actually get the trends, or who can monitor, or the plans which can be made. So there are various interventions at various level which are required, and there are a lot of work. Actually, when you say as far as quality, there are three things which comes under quality. One is a structure, process, and outcome. So we are very good as far as structural requirements are concerned. We are very good as far as manpower requirements are concerned. We are very good as far as our instrumentations of the ICUs are concerned. But when it comes to process, we as our country, other than some good corporate sector, if you see, we are grossly lacking. So following, and this is stewardship is a completely process driven management of how antibiotic can be used properly or judiciously in intensive care unit. So that is why it is very, very important. And yes, a few days back, I was taking a lecture and I was telling that leadership is the most important thing when it comes to stewardship, because it is the leader which decides. So if you have a closed system, then leadership is capable of giving its role properly, the person who has been made accountable. Because if you work in an open system or in a semi-open system, the people are more free to do their act, and what it does actually, that until the top hospital leadership is very much keen, things are very difficult to implement. So that is why a closed ICU system always makes a good stewardship program, and the outcome of the patients are also good. Recently, all of you must be knowing that WHO has launched this AWARE program. I presume all of you must be knowing about that. AWARE means A is for access, WA is for watch, and RE for reserve. So AWARE, AWARE. So access is to make this stewardship program strengthen all over the world. So this was launched by WHO, and access means all those antibiotics which you can access freely in your hospital or in your ICU. WA watch antibiotics means if your access antibiotics has developed some other kind of resistance, then you can apply those watch group of antibiotics and you can use them to see whether they are working or not. And RE is the reserve antibiotics. That means only those antibiotics which are actually made for multi-drug resistant organisms, which nowadays we are commonly growing in our ICU. So that is why this, what I could see, that if we also do the same thing, because again, it will come under the process part of implementation of any program in ICU or in hospital. So if we follow it strictly, it will definitely give a very good outcome as far as judicious use of antibiotics is concerned. So I presume that this program, which Dr. Saurav and his team is organizing, is going to be a good success, and people will at least understand that what exactly stewardship means and how we are going to implement, how we need to implement it in our hospitals. Because as I said, involvement of not only bottom line staffs, but also that the topmost person of the hospital, that is the hospital leader, means whether it is a CEO or director or whatever it is, he has to, from top to bottom, everybody has to get involved. Pharmacists carry a very good contribution for this process. If you have those facility in your hospital, otherwise nursing fraternity contributes in that part where pharmacist is required to be involved. So I congratulate, and I presume that everyone will be getting benefited out of this program. So over to you, Saurabh.
Sir, kindly can you announce the name of the award, please? Yeah,
okay. Is it there in?
Yeah, it's there.
Okay, just 1 minute. You have sent it on
yes,
to me?
What's it is?
Okay. The awardee is Dr. Abdul Ghafur from AMR Declaration Trust, and Dr. Ajay Shukla, Director and MS, Atal Bihari Vajpayee Institute of Medical Sciences, and Dr. RML Hospital, he's and RML Hospital, isn't it? So
Yes.
Dr. Abdul Ghafur and Dr. Ajay Shukla. So these are the two awardees. I declare.
Thank
Thank you very much.
Thanks. I think Dr. Ajay Shukla is not there, so I request Dr. Ranvendra Korman. She is the HOD of the Department of Critical Care Institute to accept the award and to say a few words.
Good evening, everybody. I, on behalf of our MS and Director, ABVMS Dr. RML Hospital, Dr. Ajay Shukla, would like to extend my heartfelt thanks to the Onco Critical Care Society, particularly Dr. Saurabh Das and Dr. Praveen Kaur, for giving this award to our institution. So as we all know that the working definition of antibiotic stewardship is the right drug at the right time and the right dose for the right bug and the right duration. So we at RML Hospital, we all know that this antibiotic stewardship is the main focus of this stewardship is basically the ICUs, because here majority of the parenteral antibiotics are being used. And this is now considered as a core competency of critical care practitioners, training programs, and continued medical education is needed to address this very important issue and to develop the skill in this particular field. So I would again like to extend my thanks to the Onco Critical Care Society, Dr. Saurabh Das, and I'm sorry that my director is not here, but he has already been informed about it around 3-4 days back, and I would like to take the award on his behalf. Thank you.
Thank you, ma'am. Now I want to call Dr. Abdul Ghafur. I know he is the true crusader of antimicrobial resistance in India. I request him to accept the award and to address the audience.
Good evening, Saurabh, and good evening, Onco Critical Care Society. Now, I would like to express my gratitude to the society for awarding me this Antibiotic Steward Award. It means a lot to me. I've been working at Apollo Cancer Institute in Chennai for 15 years, and working as an infectious disease consultant in an oncology hospital is certainly very challenging, especially in India with one of the highest antimicrobial resistance rate in the world. And I believe, I've been working to the best of my ability to tackle AMR inside the hospital and outside the hospitals. It is difficult to describe the emotions that come with holding the hands of dying patients, especially those who have fallen victim to the antimicrobial resistance. Their stories and struggles have motivated us to work harder to overcome the challenge of AMR. In 2012, I had the honor of being the coordinator of Chennai Declaration. It is an initiative by all medical societies in India, in the country, including Infectious Disease Society, Critical Care Society, Oncology Society, all the societies in the country, with the participation of other stakeholders. And we believe we made a significant attitude change among the medical community, the public, and the authorities on tackling the antimicrobial resistance rate. We also believe we made a significant contribution to the growth promotional use of ban of colistin in 2019 by the Indian government. And it was a landmark step by our government. And we believe that growth promotional usage of colistin ban have made a significant difference on controlling the colistin resistance rate in the hospital. Because we know that the colistin usage in the animals is dozens of times more than the colistin usage in the human. And it's the same colistin they use, the same colistin that we use. You know, we are all the veterans in the field of antimicrobial resistance. And we, probably the seniors, entered the arena when the AMR was not a popular topic at that time. It was a topic of stigma and probably even negativity. And we believe the collective work by all of us have made a significant attitude change. And today, the youngsters are keen to work in the field of AMR. It's a positive field, it's an encouraging field. And working in the AMR field has had a lot of challenges at personal and professional levels. And creating policy change is not a simple feat of task. And we had, at several occasions, we felt exhausted. And we several of us thought of withdrawing from the AMR world. But, you know, working in oncology center, again, watching the patients die, holding their hands, looking deep into their eyes, we can never withdraw from the AMR world because they need us. And we continue to work in the field of AMR because our patients need new antibiotics, they need new technology, and we need to work collectively. Thank you.
Thank you so much, sir. So now we'll wrap up this session. Thank you, producer. Thank you, Kaur ma'am, and thank you, Dr. Abdul, for joining. And thank you all our friends, all the audience for joining us. It's a small step for antibiotic to combat our antibiotic resistance, and we'll continue doing this. And thank you and good night.
Appreciable, Saurabh. Thank you.
Thank you, Dr.
Thank you all. Thank you.